Early identification is one essential component of good outcome. Once a patient has been diagnosed with having sustained a mild traumatic brain injury, favorable outcomes further depend upon support, education, and the teamwork of caregivers.
Primary care providers, family practice docs, I believe really need to be involved in the ongoing care of people with traumatic brain injuries, particularly mild traumatic brain injuries.
The primary care physician is in a unique position in the care of these individuals because in many cases you've been seeing these people for years before. So first you'll know whether there's a change, and hopefully the individual will see you as soon as possible after the injury. But then you can also see whether symptoms are improving as expected or whether the person is starting to do worse.
If you have someone with a mild traumatic brain injury and they're coming to you with a host of problems, physical, cognitive, emotional, I believe that the best way is a truly interdisciplinary approach. You have a physician that almost serves as sort of the team captain, sort of oversees everything and brings the different professionals together.
The primary care provider plays an important role in the overall treatment of these individuals because they may be seeing a number of medical specialists. And the difficulty is when you have a number of medical specialists, they're on a number of different medications. And every doctor thinks that their medication is the important one. So it's very vital to have somebody who has an overview of what's going on to decide whether the medications can be prescribed together, what medications are necessary and what are not, and how the patient's doing overall.
Sometimes family or general practitioners can find themselves in the difficult situation of getting contrary opinions from their specialists, particularly in the case of mild traumatic brain injury. So neurologists may evaluate and say, no, there's no evidence of brain injury because they're looking at it in terms of more severe brain injury that would present on a CT scan or show definite neurologic signs. Neuropsychologists may say, no, there is evidence of brain injury because they're recording emotional symptoms that they attribute to the brain injury. The converse can occur too. I mean, there's some neuropsychologists who tend to minimize the occurrence of mild brain injury, or at least the occurrence of persistent effects, and some neurologists who are very sensitive to these issues. In any case, I think when a general practitioner or a family practice doc finds themselves in this situation, they may need to be the ones, as they frequently are, to really advocate for the patient.
It's really important, I think, that the primary care physician recognize how much help they may need from a case management perspective, and that the main contact, sometimes the only contact they have into the system, is their primary care physician.
When someone sustains a mild traumatic brain injury, for purposes of insurance compensation, workers' comp claims, what have you, as medical care providers, we need to document the injury and write good reports. That sounds sort of basic, but I can't tell you how difficult it is for patients and families who are dealing with this injury just in terms of clinical recovery, and then they're battling with insurance providers on having some coverage of their time away or their damages related to this injury. If there's poor documentation in the medical record, it becomes very challenging for them to make a case for themselves.
People with brain injury may not be, and often are not, as able to advocate for themselves because of the cognitive and emotional impairments that they have, the fatigue. So again, depend on their physicians to write a good report, to be willing to support them with the insurance provider that this is in fact necessary care.
I think it's important, again, to let insurance companies or anybody know that if someone is having problems, emotional, behavioral, cognitive, whatever it is, following a traumatic brain injury, that you relate those problems to the traumatic brain injury.